Welcome to Biztecha's Health and Wellness Show. We speak to now Jim Liddle. He's the co-founder and product lead at DropBio. DropBio Health is on a mission to accelerate the world's transition to pathways for people wanting to take control of their health. The company was founded in 2018 with the aim of providing personalized early warning for changes in well-being and disease. To tell us more, Jim, welcome to the show.
Thanks, Brian. Good to be here.
Now, Jim, could you just give us an overview as a co-founder of DropBio's health history and its reason for founding?
Sure. So DropBio Health is it's an at-home health technology company, and we're really focused on improving the health of families through providing access to their own biological data, and trying to help them make more informed decisions regarding their health over the course of their life. We have 4 focus areas of the business at the moment, and these are in consumer health and wellness, employee health, primary care, as well as clinical trials and research. And kind of the reason that we founded DropBio Health was because we saw a real lack of options available for people to understand their own health in a simple and convenient way. And we wanted to make this information more accessible and more interpretable for individuals. And at the same time, we also saw a movement where people were trying to become more informed about their health and about what they should be doing to lead healthier lives. And then probably the final thing in terms of kind of why we found the business was we started to see a shift in the healthcare sector, where companies are trying to be more health and patient-centric, and actually provide more services to people in their own home. And we actually saw COVID really accelerate this shift, especially in Australia, with the telehealth adoption rates that we saw. And so it was kind of a combination of those factors which kind of led us to founding DropBio Health.
And also, Jim, one of the key things is really a paradigm shift, isn't it? Companies like you and the thinking around it is around a wellness paradigm as opposed to the traditional illness-based paradigm. So you basically think about your health traditionally when you were sick or something goes wrong. Here, exactly. You're talking about when you're well, you want to make sure that you stay well.
Yeah, exactly. It's that shift from being reactive in our healthcare to just being more proactive. And I think we see a key thing is actually understanding what health is to us at any point in time of our life, and determining what things we can be doing to maintain a good level of health, and trying to delay or prevent that transition to a poorer state of health.
Okay, so then Jim, walk us through then the technology and the product innovation behind DropBio Health, and what does that make you special or different from other people in this space?
Sure. Yeah. So I think there's a couple of kind of key components. So we're not developing any kind of unique technologies as such, but what we do is I guess our innovation is bringing together a bunch of different technologies which have been used in different areas of healthcare or technology, and bring them together into one platform, which enables, I guess, our products to function. So one of the key things that we have is an understanding about how blood samples degrade through post. So obviously, we do at-home blood testing services, and the big issue with that is, well, what's going to happen to the blood sample when it comes through the post back to the lab? And so one of our key kind of innovations and areas of expertise is understanding how that blood sample changes and being able to account for that through the post, which enables us to then obviously measure and accurately measure blood biomarkers that are collected, say, at home. Another piece is around our lab methods. So in our lab, we use off-the-shelf laboratory equipment, which is used in research labs and pathology labs. But we've developed methods to use really small volumes of blood, like as we do collect at home, to then still get same robust, accurate answers out of those laboratory pieces of equipment. And then probably a final one is really around how we translate that scientific, technical information into something that's actually understandable by an individual who might be interested in health, but they might not be scientifically trained or medically trained. And so it's how we translate that information, make it understandable, place it into the context of an individual, their current comings and goings, their lifestyle habits, and then also how we create kind of action based on that.
Now break it down for us. I'm a customer of yours. I've sent a blood sample over to you. I sign up for a subscription, and I believe that I can do a 12-month subscription and get tested every quarter or every half a year or so forth. Tell me how, and explain to our audience, how does this work as a service? We send it over to you. We sign up for the subscription. We send it over to you. What do you send back to us, and how do we action upon it?
Sure. Yeah. So if you're a general consumer interested in their health, you'd go onto our website and you can purchase one of our subscriptions. When you purchase, we then will ship out a kit from our lab, and it'll come straight to your home, and that will be there in a day or two. And then in the morning, in a fasted state, you can just take a simple finger prick blood sample, just using a little lancet, and then you package that up, and then you just give it back to the postal service, and that comes back to our lab, usually within a day or two as well. When it comes back to our lab, we then analyze those samples, and in the meantime, you complete a lifestyle survey, which helps us to understand what actions you're taking in your day-to-day life, your lifestyle, which are really positive for your health, but also ones that could be improved. And then we combine those pieces of information to essentially understand where your health is currently, and also what actions you could do to improve it, and then focus recommendations based on the actions that you could do to improve it and the areas of health that you actually might need to improve. So it's kind of bringing those together.
An app, right?
Yes, this is a web app, so it's not a mobile app. It's all done on the computer, just through a browser. But it's your own secure account that's only accessible by yourself.
Okay, you've been around since 2018. Give us some insights into how you've helped Australians improve their health and lifestyle.
Sure. Yeah. So we've been around since 2018, and we launched our first blood testing wellness service in 2020, and obviously this was in the middle of COVID, and so we're going through lockdowns, and I think we realized at that time actually how valuable it was to be able to reach somebody in home, and just live in that kind of environment. And what we saw is that people would take these tests. I do mine every 3 months, and we see that when someone does their first test, it's kind of like a baseline. It's like, oh, this is where I'm going to start from. But then what we actually see is that their lifestyle, they'll select certain aspects of their lifestyle. They go, oh, actually, you've highlighted an area that could be improved here that I should improve. And then we see them improve those. And then we actually see how those blood markers improve over time as well. And so I think that's really the key bit here, is around getting that feedback from the product and then implementing those changes and then seeing the improvements that you're making, and it kind of reinforces those healthy habits.
Give us a sense of the sort of numbers that are your customers right now, because you've got a direct-to-consumer business. Obviously, you also have a corporate business, and as you mentioned, a primary care business as well. Break it down to us how your customers have evolved, and what sort of numbers are we looking at?
Yeah, sure. So we started completely focused on B2C, and that was partly because we thought that the B2B world and engaging more directly with the health system would be a bit of a slower process. And so we were selling kits to hundreds of consumers in Australia in kind of 2020-21 timeline. But then because of COVID, we think that shift from the businesses in wanting to have those at-home services and trying to become more patient-centric started to occur. And so then we actually kind of shifted our focus a bit. So we still have our B2C market, which we kind of, we sell, and we've got hundreds of customers in that space, and that helps us keep close to them. But really our focus is on B2B, where you're doing deals with thousands, tens of thousands through those channels. And so that's really where the focus is now.
So Jim, I want to drill down on this, because this obviously will be clear from some other questions I will ask you later in the show. When you're dealing with your B2B customers, are employers buying these services, your services, for all the employees, or is it selected employees?
Yeah, so it's a good question, because the traditional, say, employee health is just for the top level management, and I think part of that is the cost associated with some of those more traditional kind of C-suite health tools, and what the engagements that we're having is actually looking at the whole employer base and how you can engage every employee with our services, because we're driving healthier lifestyles, better health outcomes in these areas. And so we're trying to bring it down from that C-suite and actually down to the whole employee base for these employers. And I think that's largely been driven by the employees wanting and kind of pushing their employers to have more of a focus on their health as well.
Now, one of the things that I see immediately as you've been explaining it that will happen is this: healthier employees can also translate to, of course, better productivity, but also from a cost saving wise, lower insurance premiums for employees. Have you already seen that happening?
So in Australia, because of I guess how our health insurance system is set up, we haven't started to see that, but we do see that as an eventual next step here, is that the kind of health economics around employee health and the engagement with the health insurer does start to change. And so I think going forward, as we can prove out a lot more of those health benefits and the improved health outcomes of employees when they engage with Drop By Health products, then I think that's the natural kind of next step to see.
So then, Jim, give us a sense of the size of customers, of some of the big names that perhaps you work with that provide this benefit to the employees.
Sure. So I can't talk specifically about an employer health one at the moment. Okay. But one I can talk to, which is one of our partnerships with Virtus IVF. And so we formed this partnership a couple of years ago, and it was really around how can we improve IVF success rates in their business. And that's been an amazing partnership, because we've been really focused on the same goal of trying to improve these health outcomes. And we're partway through the clinical trial at the moment, but I think there's some kind of exciting outcomes that are on the way for that one.
Now, what can we expect from Drop Bio Health in the next 12 months?
Sure. So we're currently in the process of upgrading our lab accreditation and also expanding our range of tests available. So at the moment, we've got a certain range of tests, but we're always looking to expand the range of tests that we can provide in this at-home testing space. So we're looking at the next 12 months to bring on a bunch of new products, a bunch of new biomarkers that you can measure to learn more about your health. And then we're also looking to expand our clinical trials and our research programs as well. So we're working with a bunch of partners here at the University of New South Wales, as well as some other companies on some clinical trial work as well, which is really focused on decentralized clinical trials, which enable an individual to participate, from their own home and not having to be co-located with a certain institute or clinic. And so I think there's some exciting opportunities that are coming down the track in the next 12 months.
Now, you're very Australia focused right now. What are the plans to expand outside of Australia, if there are any?
Yeah, sure. So we started off in Australia, obviously, and it's in the scheme of things a small market, and really we see our platform as being applicable and transferable to a lot of different countries. And so as we look at Asia and the opportunities in the health sector and the transformations that are occurring in Asia, and especially Southeast Asia, I think there's a couple of countries that are of interest to us, and deploying our services in those places like Singapore, Malaysia, and also India, I think are really interesting because I think the services and the products that we provide could really assist in the transitions in those countries.
Jim, it's been a great conversation. I've learned a lot and looking forward to using your services, in fact, to make sure that my health is a little bit better moving forward. But before we leave, any final thoughts you'd like to leave the audience with?
I think probably just one final one is around this transition that we are seeing from a reactive healthcare system to a proactive one. And just all the different technologies that we're seeing that are facilitating that transition. We're seeing these really interesting kind of ecosystems evolve that are really focused on that proactive healthcare space, and also providing better services, providing more in-home care, things like telehealth, e-prescriptions, and things like that. And for us, at-home blood testing as well is a core component of that. And so I think it's just a really interesting time to be involved in healthcare, and being involved in that transition going forward. So,
Jim, thank you very much for coming on the show.
Awesome. Thanks a lot, Brian. Thanks for having me.
I'm Brian Fernandez, and we've been speaking to Jim Liddle. He's the co-founder and product lead at DropBio. And this video and podcast will be on our social media platforms, as well as our website, www.biztech.asia. Please like and subscribe to our various platforms. Thanks a lot for tuning in.